Welcome to our presentation on electronic health records, a teaching tool. Our project's goal has been to create the TeachEHR electronic health record system, which is useful for teaching nursing students how to use electronic health records. It's our goal to use a layout that looks like Facebook to be teaching something that's difficult to use and create it as an intermediary tool. Why are electronic health records needed? And also, what are they? There's a lack of availability of commercial EHRs to be used in the academic environment, and the ones that are available have a high cost, about $50,000 for 3 years. Also, the government is mandating the use of electronic health record systems in hospitals. Electronic health records is the goal to replace paper records in hospitals with a tablet computer version that's easy for people to use near patients' beds. As a part of our system, we've worked to integrate this with our lab so that students can use the system inside the patient simulation labs. Here you can see students actually using our system. This student is administering a medication to the patient, so she first scans the patient's wristband barcode and then scans the barcode on the medication, after which the system will tell her it's okay to administer the medication, and she administers it to the patient. Next, we see nurses taking the vital signs of our patient, such as pulse and blood pressure. Also, temperature. She's then dictating these items to the nurse behind her to enter them into the electronic health record system. Here, a nurse checks the different breathing items for the patient, and the nurse in the background enters these items to the system, making use of our system's tablet PC functionality to be able to draw instead of having to type all the items into the system. To enter vitals into the TeachEHR system, begin at any patient's main page by entering the patient's temperature, pulse, respiration, blood pressure, O2 saturation, liters of oxygen, or 0 if they're on room air, and blood glucose level. Teachers also have the ability to override the inserted time, so that they can enter base data for patients, and select how the temperature was taken. Clicking Add will then save this item into the patient's history. Teachers can also come in and comment on these items by clicking Comments and Add Comment, so that they can comment on things such as, you took the pulse incorrectly. Once the comment is added, there is now one comment and the comment shows up. Teachers are the only people with the ability to delete items from the system. It's also necessary to show the nurse's notes feature, where students can either add text such as head of bed raised, side rails ×2, or draw items, which will allow the students to draw pictures, which may be easier to demonstrate different items such as where a break occurred in the arm. Once they've saved these items, teachers can come in and comment on them by simply drawing over top. You can also enlarge the photos to view them at the full size rather than the smaller size. Daily assessments have different fields which are selected by the teacher. The teachers can also determine what fields should be drop-downs and what the options should be in these drop-downs. Once a daily assessment is completed, it's shown in the patient history at the bottom of the page. Clicking View Daily Assessment will expand the daily assessment and allow you to see the different items in it. You can see where these items were filled out, but the other items were left blank, so the system substitutes blank in red. You can also enter lab reports in the system by going to the Lab Reports page. From this page, teachers can upload a lab report, which are then converted to images. By clicking on the image, a student can view the lab report full size and note items that were out of range in this lab report. By saving this, the student has then made a saved image which the teacher can use to see that the student realized that that was out of range. User history allows the student or teacher to go in, click on a name, and view the order items were completed. For the student, this could be used to create a walkthrough by the teacher, or the teacher can use it to make sure that the student completed items in the proper order, such as checking vitals before administering a medication. In summary, this is a teaching tool that's been developed by creative inquiry students for nursing students to try to make the transition into commercial EHR easier. Our EHR tool currently includes medicine reconciliation, patient data entry, patient scenarios which will be developed by the faculty, and the ability for students to work together in groups. We'd like to thank Dr. Pruitt, the Director of Nursing, for purchasing the tablet computers used in our project, and Creative Inquiry and the Calhoun Honors College, who've helped support this project. This video has been put together by Lauren Klingman, Mandy Zent, Lindsay Maxwell, Ashley Smith, Trent Robbins, and Jenna Bergen. Our faculty advisors are Dr. Nancy Meehan and Dr. Roy Parkes.